Thank you, Mr. Chairman. Mr. Secretary, it's good to see you. As you may know, I spent nearly 3 decades in healthcare as a therapist, rehabilitation services manager, and licensed nursing home administrator prior to being elected to Congress. I served patients from rural communities throughout central Pennsylvania during that time, and I learned the unique barriers these communities face in accessing quality, affordable health care. And while I appreciate your stated goals of expanding coverage and access to care that you detailed in your testimony, your agency's recently finalized rule establishing minimum staffing requirements for nursing homes seems to fly in the face of these goals. Ms. Secretary, do you believe that nursing homes across the country today have enough staff to meet their current needs?
Congressman, first, thank you for the work that you did in this space because it's essential for so many families. There's obviously something going on within the nursing home industry where, while they represent about less than about 1/3 of 1% of all Americans living in nursing homes, when COVID hit, we saw 20% of people dying living in nursing homes. That disparity shows that there's something going on.
Mr. Secretary, I will say that was because one of the huge contributing factors of that was bad policy by governors like my former governor, who required the readmission of nursing home residents diagnosed with COVID back into these populations. It was many of these people died as a result of bad public policy that was put forward. So, you know, I mean, but getting back to my original question, do you believe that that nursing homes across the country today have enough staff to meet their current needs? Yes or no?
I believe that too many of these long-term care facilities are not providing the staffing. In fact, the comments we received to our rule made it clear when people are talking about having 5 CNAs, certified nurse assistants, available for 55 residents. Clearly, that's not enough. When people are talking about a resident had a stroke and was on the floor for more than 15 minutes because it was breakfast time, not enough staff knew, and it wasn't until they were collecting the food trays that they discovered there was this person on the floor who had suffered from a stroke. Clearly, there are not sufficient numbers of qualified people.
Obviously, I keep close contact, obviously, having worked with older adults and specifically in many different capacities, including, I think, perhaps the only former licensed nursing home administrator between the House and the Senate. I may be wrong about that, but I think that may be accurate. It's certainly not what I've heard from nearly every provider in my district. So I would encourage you to engage with these providers more closely to learn about current conditions on the ground. Yeah, it's important for federal agencies to engage with local providers and stakeholders, and I would encourage you to do more of that certainly in the future. According to your department's own estimates, under the proposed staffing minimums, nursing homes around the country would need to hire nearly 13,000 registered nurses and 76,000 nursing assistants. That's actually where I started my career, working as a nursing assistant as I worked my way through my undergraduate degree. Can you certify here today that not one senior across the country will lose access to care as a result of this proposal?
Carson, what I can certify is that if one single American, your loved one, my loved one, is going to go into a nursing home, we're going to try to make sure that they are provided with safe, quality care because there will be the staff necessary to provide that care.
But in terms of access, having available facilities that are still open is an incredibly important part of that. Do you believe that nursing homes in rural areas that already face staffing shortages will be forced to close their doors or drastically reduce the number of seniors that they serve if this minimum staffing mandate takes effect?
The rule takes into consideration rural health facilities, nursing home facilities, as well as smaller nursing home facilities. We provide them with a longer transition time to adopt these new rules. We also provide them with a hardship exemption. They can show that it would be tough for them to meet the standards. They have more time. So we've listened to a lot of the facilities, and especially those in rural communities and those that are smaller.
So in terms of listening them, how do you expect nursing homes to pay for the cost of implementing this rule, which your agency estimates will cost between $1.5 billion to $6.8 billion to fully implement?
Congressman, the way I ask the question is, what kind of operation do you have now if you're saying you don't have the people you need to take quality care, to provide quality care to the people who are your residents? Because what we're simply saying is you should have a minimum level. We're not telling them they have to hire more than that. We're just saying have a minimum level so you don't have the situation as occurred in Ohio where an individual who was in a nursing home was suffering from a wound because they didn't get wound care and diaper changes and feeding. Ultimately, that wound became a bed sore. That sore then became, got to the bone and ultimately to the death.
Having worked many years in nursing homes, both as a delivering that care and as an administrator, I certainly understand that, but I also understand that when you're dictating and mandating from Washington without bringing the people to the table that provide the care, what you're doing is actually creating a decrease in access to care at a time when our population is aging. Thankfully, most people age with
gentleman's
dignity
time
and
has
don't go into a
expired.
nursing home.
Gentleman's time has expired and now recognize